สวัสดีค่ะ and good afternoon to you all. Welcome back to the English language summary of the daily press briefing on the COVID-19 situation in Thailand, live from the Center for COVID Situation Administration, or the CCSA. Today's briefing will be for Monday, the 5th of July, 2021. Just now, we received a briefing from Dr. Teasing, followed by a video clip presenting Dr. Prasit Watanapa, the Dean of Siriraj Hospital, who gave us some insights of why it is important to have the elderly and vulnerable groups vaccinated as soon as possible, and also how we will be treating and coping with the increased number of patients being hospitalized for this time being, and is also the basis for today's CCSA's operational meeting, which I will dive into details later on. But let me start today by looking into an update of the national vaccination drive. So, as of yesterday, which is Sunday the 4th of July 2021, we have now administered a total of 10.7 million doses of vaccines, and out of this number, 7.8 million persons have received their first doses. 2.9 million persons are now fully vaccinated. So the inoculation drive right now covers 25.4% of those residing in Bangkok and its peripheral provinces. And for nationwide coverage, it now stands at 10.8% of the entire population. So let me now bring your attention to the new statistics for today. We have today new confirmed cases standing at 6,166 cases, which you see now on the slide. Brings us to a total of right now 63,520 active cases. In those active cases, we have 2,199 who are still in critical condition and 603 who are on ventilators. The new number of recoveries today stand at 2,534. So the total recoveries we have to date is 223,437. The number of new fatalities, unfortunately, today stands at 50, and that brings us to an accumulated total of 2,276 fatalities. And we send our deepest condolences to those who are mourning loved ones who've passed away from COVID. And again, this is a harsh reminder that we must still continue to observe public health measures regardless of our overall fatigue of the situation, because letting our guards down, even for a short moment, could be the cause of more infections and even possible deaths. So let me now turn your attention to a slide of the overall situation in Thailand. On the screen right now we have a slide on the highest numbers of cases by province to date. Bangkok again stands at number 1 at 1,729, followed by Samut Prakan at 411, Samut Sakhon at 389, Pathum Thani at 352, Songkhla at 318, and you'll see the other provinces following suit. And you can notice that these are still the same provinces. We continue to have clusters and infections in the same provinces. Now I'd like to talk about the operational meeting we had today at the CCSA meeting this morning, which was very fruitful. Today, the Department of Disease Control at the meeting made an observation that the number of new confirmed cases in provinces outside Bangkok metropolitan area is now steadily increasing due to the spread of the new variant, the Delta strain, which is becoming more prevalent nationwide as well. And the CCSA would like to urge everyone to avoid trans-provincial travel at all costs. And if travel is necessary, we urge that the travelers isolate themselves and inform village health volunteers or local health authorities of their arrivals as soon as they come to their destinations, and observe all the measures that have been announced by the provincial health authorities very strictly. And also the meeting discussed how to cope with the steadily increasing numbers of COVID patients in hospitals. And some measures are going to be updated, as I mentioned last Friday. So the Department of Medical Service is now updating their guidelines for home isolation, as well as their standard operating procedures for community isolation centers. Private hospitals will now also join and help the public hospitals in providing support for infected persons who are in home isolations by providing them with essential medical equipment, medicine, and meals as well. And also, the meeting discussed how to improve capacity of hospital beds and facilities, because right now in Bangkok, more than 90% of hospital beds are now occupied, and therefore the Ministry of Public Health has increased the capacity of Busarakam Hospital, which is located in Muang Thong Thani, now with a number of 1,500 beds, and we very much appreciate that support. And additionally, over 30 provinces have reached out and introduced the so-called No One Left Behind program, and they're inviting COVID-positive residents who are working in Bangkok to return to their hometowns and to be treated at hospitals in their provinces, in their hometown provinces. And those who wish to return to their hometowns can make a request to the local hospitals, and these hospitals will provide specific transportation to transfer the patients back to their hometowns. And patients must by all means not travel by public transportation, but be transported by these hospitals. And furthermore, the Bangkok Metropolitan Administration, or the BMA, will open 6 more isolation centers at COVID-affected communities for infected persons who show little or no symptoms. And these centers will help isolate patients from their households and communities as soon as possible, and will also take care of them with basic medical procedures and also necessities while waiting for hospital beds. And the centers will also look after the children of those patients. And also, they will also take care of children of parents who are caretakers, who are away on COVID-19 treatment at field hospitals or at normal hospitals. The CCSA meeting this morning also asked the BMA to open at least 20 centers around the capital as soon as possible, and we hope that these can help bring relief to those patients who are waiting for. Now, I'd like to take this opportunity to stress once more that the government is doing its utmost best and everything in its capacity to prevent further infections and and fatalities. And the CCSA, as I've earlier mentioned, is now imposing new measures to speed up testing, isolation, and hospital referral processes, as well as exploring new disease control measures to flatten the curve. The government has been aggressively pursuing its national vaccination program, and last week we already achieved our milestone of administering 10 million doses of vaccines within June. And we hope that we can stay on track to provide 10 million more within this month. And however, with the spread of the Delta variant, the Ministry of Public Health is now focusing on inoculating vulnerable groups as fast as possible. So 70% of the elderly and those who are medically vulnerable, those who belong to the 7 risk groups residing in Bangkok metropolitan area will be administered inoculations and vaccinations within 2 weeks from now, while the vaccines to the high-risk groups nationwide will be targeted for August. And the reason is Bangkok still continues to be the focus, or the focus of the new Delta strain infections is still concentrated within Bangkok and its vicinity. Because of these adjustments and because of the overall shortage of supply of vaccines, the CCSA therefore acknowledges that there will be vaccine shortages for other age groups. And we understand that this might cause frustration as well as confusion to many of you, particularly our foreign audience who are waiting for their vaccine appointments. We'd like to assure you that the government's policy in providing assistance and vaccines for everyone residing in Thailand, everyone who's on Thai soil, will continue. And this still stands. And the government is negotiating with vaccine manufacturers and governments abroad to help meet our vaccine demand as soon as possible. And we'd like to give a shout out and a great big thank you to the governments of the United States, of China and Japan, who've reached out and helped us with vaccine supplies very recently. And as soon as our vaccine supplies are replenished, we will see that more and more people will receive confirmations for their inoculation appointments. Before I go, I'd like to say that Phuket Sandbox is a pioneering model into the future as we learn to live with COVID as a common disease like any other. And it should remind us that in the future we will eventually defeat COVID if we stay resolute on our path of vigilance and our collective efforts, so that we may very soon have Phuket Sandbox replicated in other parts of the country. So we will bring you updates on how Phuket Sandbox is doing as it progresses. Right now, the system is moving along very smoothly, thanks to the dedication and hard work of authorities down in Phuket, as well as visitors who are working with us to comply with our preventive measures. So, let me conclude by reminding you once again that we must wear masks at all time, even though you've been vaccinated, and try to work from home as much as possible, avoid large gatherings, and refrain from dining together. We'll be back with the English summary of the daily press briefing again tomorrow with Kun Natapanu. I thank you very much for your kind attention today. ขอบคุณค่ะ สวัสดีค่ะ
ขอบพระคุณค่ะ